Good morning, it's Friday, June 19th, and this is Sentinel Today from the Daily Sentinel. This episode was brought to you in part by Bank of Utica, in a league all of their own. Today, Mohawk Valley Health System and Excellus Blue Cross Blue Shield have announced a 3-year effort called the Mohawk Valley Partnership for Healthy Lifestyles Initiative. Before we jump in, here are a few other stories that you should know about. Testimony on Thursday in the attempted murder trial of former county sheriff's deputy Aaron Alshaman focused on security camera footage from the neighborhood around the victim's home. A group of churches in Waterville, Morrisville, Oriskany Falls, and Hamilton will soon be united as one parish. The Utica Zoo is retiring its annual Brewfest fundraiser after 27 years, though officials say new community fundraising events are planned for the future. For more on all of these stories, visit ursentinel.com. Next, let's dive into today's feature story. Utica is seeing a new push to catch chronic disease earlier, before it turns into a medical crisis. Mohawk Valley Health System and Excellus Blue Cross Blue Shield have announced a 3-year effort called the Mohawk Valley Partnership for Healthy Lifestyles Initiative. The program is backed by a $150,000 grant from Excellus, and it focuses on locals who may be living with chronic conditions, but do not have regular access to primary care. The goal is simple: meet people where they are, identify health problems sooner, and connect them with care before those problems become emergencies. The initiative will focus on conditions like diabetes, high blood pressure, and obesity. Through community outreach, education, screenings, and referrals, organizers hope to reach underserved residents, including refugees, low-income families, and minority populations. MVHS President and CEO Dr. William Lecates said the effort is about shifting attention from treating illness after it happens to preventing illness in the first place. He said hospitals often focus on injury and disease once patients arrive for care, but prevention is central to improving health across the Mohawk Valley. That prevention work is especially important in the region. MVHS and Excellus say the county ranks among the least healthy counties in New York, with higher rates of preventable hospital stays and emergency department visits than the statewide average. Excellus Utica Regional President Tony Vitagliano said the partnership is designed to reach people who are not getting the care they need. Without primary care, conditions like diabetes, obesity, and high blood pressure can go untreated until they become severe. The program builds on outreach work already underway at MVHS. Tracy LeBaire, Supervisor RN of Community Outreach, said the health system educated more than 12,000 people in 2025, completed over 4,000 blood pressure screenings, followed up with hundreds of people who had elevated readings, and referred more than 300 people to primary care providers. That work has continued in 2026. From January through May, MVHS reported educating 6,500 people, conducting 1,900 blood pressure checks across 95 community events, and connecting 168 people to primary or specialty care. Over the next 3 years, the initiative will track measures like A1C levels, blood pressure readings, and quality of life, with the larger goal of improving chronic disease management and reducing preventable complications across the Mohawk Valley. Finally, the Utica Zoo is retiring Brewfest after 27 years. The annual August fundraiser, which featured craft beers, ciders, and seltzers on zoo grounds, will not happen this year. Zoo officials called it a difficult decision and thanked the vendors, volunteers, partners, and attendees who supported Brewfest since it began in 1998. The zoo says it still plans to host community fundraising events in the future, but has not announced what will replace Brewfest. That's all for today. Thanks for listening. For more on all of these stories, visit us at ursentinel.com. Right now, you can get unlimited digital access for just $1 per week. And if you like this episode, make sure to leave us a review wherever you listen to podcasts.